Irishman says good morning. The Baganda say mwasuze mutya. The Itesot say yoga atupuruchi. The Lugubara say mingoni. The Madi say owira. The Acholi say ichoni ning. The Ankole say bwashesha. The Wakonjo say bwakere. The Kumam say benyo. The Samia say olio otiam. These are all the different cultures that we have in our university and even in this country, Uganda. And basically, this is Mutyaba Ibrah, the GRC School of Health Sciences aspirant. And I'm basically here to inform you, to appeal to you that come tomorrow, Saturday, please vote for the right person into the job. I want to say that we can't change the beginning, but we can start from where we are and change the ending. That is through the constructive and developmental ideas that I intend to bring on board if at all I'm given a chance into power. To start with, I want to work on the retakes that are already here. As of right now, retakes of 49 and 48 are being administered, and I want to say this is unfair, and we are going to fight against these retakes. We've already done this in cohort 2020. We were successful. People who had 48 and 49 in pharmacology, they were added and they managed to progress. I've extended the initiative to the cohort 2021. The initiative is actually undergoing so that these people, their retakes are actually solved. I want to prevent the getting of more retakes, in that improve people's performance and even improve our CGPAs, because at the end of it all, our CGPAs will matter. I want to advocate for the separation of the schools so that we have the College of Nursing and maybe the College of Medicine. This will come along with certain advantages. In the first place, as of right now, nurses are actually doing the same examinations with medicine, which is not fair, because in the first place we enter with different points, and even when you look into the retakes, you can actually realize, okay, not all, but at least some of them actually belong to them, and this can be the reason. Also, the separation of schools will actually come along with another advantage, in the way that right now the medicine group is actually a neglected group. Nurses have their head who takes care of their welfare. For example, the people in clinicals, the nursing students, are actually receiving gloves and masks which are meant to protect them while they are serving the patients. And with this kind of separation, the welfare of the medicine students will also be looked at. I want to come in and actually secure safe, better and affordable places of residence in town near our hospital, near the Soroti Regional Referral Hospital. Because if students progress to clinical studies, it is pertinent that these students are actually near the hospital, that we eliminate the transportation. These students can actually have access to the hospital even at night or even at all hours. And then the other thing is about the issue of these hostels. How am I basically going to do this? In the first place, I and the Dean of Students, I'm intending that we shall go and speak to some of the motel owners around the hospital, convince them to actually convert this into a hostel for students. This will come along with certain advantages, in that we shall be allowed to pay semester-wise, which we can afford. In addition, I'm also looking at some of the private houses. There are some houses, like right now there is one which I actually saw. It has 8 rooms. Students can actually come in and pair up in this kind of house. I want to advocate for the implementation and even giving of students their faculty allowances. And then this faculty, in the first place, the money that has been promised is actually little. And I want to advocate that let this be increased and let students be given their faculty allowances, because these are important, since they are going to be used to buy the equipments which are needed in as far as clinical placements and handling patients is actually concerned. I want to advocate for the increment in COBA's money, which is community-based education, research and services. This is a semester this is a course unit that we have in our semester. And like previously, the cohort 2019 went in for this course unit, but they were given very little money to which they could use in their welfare while in the field work. And I want to advocate for the increment. These students need to be given more money, because this is the money which is given to both private students and government students, and it should be increased. I want to advocate and start up discussions in as far as establishing a paper which protects a student who has missed establishing a policy which protects a student who has missed a paper due to a genuine reason. I want to take you through what's called the Kasule story. In the last semester, Kasule actually, he went to Kampala to visit the mom. While he was there, he got an accident, and due to that, he actually spent a lot of time in Kampala, longer than he expected. While he was there, we did a pharmacology cut, and he sent a message to the pharmacology department explaining reasons underlying his absence in the cut. When he came back, he actually expected to present his medical documents to the head of department, and with that we all expected that the cut is actually going to be availed. But unfortunately, the HOD of pharmacology, that is Dr. Winnie, told him that, please Kasule, there is actually no policy to guide me in as far as giving you this kind of paper is actually concerned. It's on that note that I want to advocate, that I want to start up discussions in as far as establishing this policy is actually concerned. And to this, they have told me, Ibrah, that's a long shot. This is how I've answered them. I've told them that the mere fact that as of right now, there are some heads of departments who share with us a similar vision of the presence of this kind of policy. That is the anatomy department and even the microbe department, because these departments are giving out these papers. The mere fact that we share that vision together, I think, and I'm actually confident that with a conjoined force of us, the students in the guild, pushing from one side, and even those concerned heads of departments pushing from the other side, we shall be successful in as far as establishing this kind of policy is actually concerned. I also want to speak to the concerned stakeholders that let the medicine guys, before they progress to their clinical years, be grounded in some basics of first aid. Because when I was consulting from the different cohorts about some of the challenges that they are facing, the cohort 2019 actually told me that there was a gap between the medicine and the nurses. Since the nurses had been grounded in the basics of first aid, there is a way it was easier for them to manage to manage emergencies. Like, for example, if people are brought in due to a road accident, you get. But then the medicine students, since most especially the direct entrance, since these had not been grounded in the basics of first aid, they were unable to actually implement and even manage these cases. And I think if at all these students can get these basics, and what do I intend, how do I actually intend to accomplish this? I want to request the concerned stakeholders that let the medicine guys, while nurses are having this course unit, even the medicine students can join them, and so that we can get those basics before we actually progress to third year. With all those ideas and even many more, I want to inform all members that Mutyaba Ibrah is a capable leader. He's a person who is tested, you get, because I've actually been here along with the students who've been handling a lot of activities. And even with these ideas, with the fact that you're sure that I'm going to implement them, because even some of them have already started, I want to request for your trust in the first place. Due to the fact that I've been here with the students, I've already done some of part of the aspects of my manifesto. You get. I want to request for your support. The support can be in terms of advice. Nobody knows it all. None of us knows it all or is the best of creation. It's on that note that I call upon your advice to guide me and tell me that maybe here and here is how maybe we need to go about things. And lastly, I want to request for your vote come Saturday. I request that you actually tick for the right person, and that is none other than Mutyaba Ibrah, School of Racial Sciences. A good, nice time to all of you.